Good evening, everyone, and a very warm welcome to the 20th anniversary gala of the Victorian Rural Health Awards. I'm Ellen Jackson, and I'm honoured to be your host tonight as we celebrate 2 decades of recognising the remarkable dedication of our rural and regional health professionals across Victoria. For 20 years, these awards have shone a light on the individuals and teams who keep our communities healthy, connected and cared for, often quietly, often tirelessly, and always with heart. We know that many of you lead incredibly busy lives, often on call and always on the go. That's why we've pre-recorded video messages from each of tonight's winners. If you can't stay for the full event, don't worry. All the highlights and heartfelt moments will be available on the RWAV website in the days ahead. Now, just because we're virtual doesn't mean we can't bring the energy. Okay, we're going to have a little bit of fun. On the count of 3, I want you to send through your favourite emoji to celebrate 20 years of rural healthcare excellence. Are you ready? Okay, here we go. Number 1, and 2, and 3. Go for it. Wow, look at that. There it is. What a brilliant audience already. A little click of appreciation goes a long way. We'd love for you to be part of the celebration all night long. Drop your message in the chat, give a shout out to your team, or take a selfie and tag us using hashtag VRHA25. Share a moment that's moved you or tell us what rural healthcare means to you. Let's fill the feed with pride, appreciation and joy. So wherever you're tuning in from, whether it's a clinic, a hospital break room or the comfort of your home, tonight is for you. Let the celebrations begin. As we gather tonight for the 2025 Victorian Rural Health Awards, I would like to begin by acknowledging the traditional custodians of the land on which the RWAV offices stand and where this event is being recorded and broadcast from, the Wurundjeri people of the Kulin Nation. The Wurundjeri people have cared for this land for thousands of years. Their traditions, including a welcome ceremony, have long offered safe passage and shared understanding to those arriving on country. In that spirit, we respectfully welcome Wurundjeri traditional custodian Tane Garvey, who will now perform the Welcome to Country.
Good afternoon, everyone. My name's Tane Garvey and I am a Wurundjeri man from out at Hillsville. And I'd just like to start off by first of all paying respects to my ancestors and my elders past and present, but I'd also like to take the time to acknowledge everyone else that's come out to listen to this welcome today as well. It's important as the people that live on this country to respect this country, and as the traditional owners, our boundaries stretch from the Werribee River up to Mount Baw, across the Great Dividing Ranges and all the way back down to Mordialloc Creek on the other side. Our almighty creator and totem is Bunjil the Wedge-tailed eagle. And with that being said, I'd just like to pay respects to all tribes that make up Kulin Nation. And so down here we have Wathaurong to the west, we have Dja Dja to the northwest, we have Nurrailum directly north, Tunarong to the northeast, and Bunurong Boonwurrung that wrap around down to the south. It's our job, again, as the people that exist on country, to have a positive relationship with country. There is no limit to how far reconciliation can go as long as it's done the right way and as long as we're heard as traditional custodians. And there's no limit to the love or the kindness that we can show other people. I've always believed that there's also no limit to how great this country can be as we start to embrace our different cultures and indifferences in general. And so with that being said, I'd just like to say Wurundjeri, Womanjiga, Mbaluk Yimi Kudibik, Womanjiga Baluk, Womanjiga Karaps, which means you are most welcome to the land of Wurundjeri people today. Welcome to Country is about purpose and respect. So we've got to carry purpose and respect with us as we move throughout country. What is our purpose? Why is purpose important? And are we going to move through country in a respectful way while we conduct that purpose? So again, Nungojin, which means thank you, and have a wonderful day. Thank you.
As a coaching psychologist based in Ballarat, I've had the privilege of walking alongside professionals across rural and regional Victoria, supporting them to find purpose, build resilience and thrive in the work that they do. And I can tell you this, in no other setting is that purpose more profound than in rural and regional healthcare. Our health professionals are more than just clinicians. They are lifelines, leaders, mentors and neighbours, often all at once. In towns where a single doctor or nurse can change the trajectory of an entire community, their impact is not just personal, it's generational. Tonight we honour that impact We recognise the extraordinary individuals and teams across rural Victoria who give their all to keep our communities healthy, connected and strong. Proudly supported by the Victorian Department of Health and championed by RWAV, these awards have celebrated rural health excellence for 20 years. In this milestone year, we're thrilled to present 13 prestigious awards to those shaping the future of rural healthcare in Victoria. Let the 2025 Victorian Health Awards begin. To officially open this evening's celebration, it's my great pleasure to introduce someone who brings not only leadership but lived experience to the cause of rural health. The Honourable Marianne Thomas MP serves as Victoria's Minister for Health and Minister for Ambulance Services. She's also the member for Macedon and someone who grew up in northeast Victoria. Minister Thomas is a passionate advocate for regional communities. Her commitment to ensuring every Victorian has access to quality healthcare is not just part of her portfolio, but part of her story. Please join me in warmly welcoming the Honourable Marianne Thomas, MP.
I would like to begin by acknowledging the traditional owners of the lands on which we are all joining from. I'm joining you today from the land of the Wurundjeri people, and I wish to pay my respects to their elders past and present. I would also like to extend that acknowledgement to all First Nations people who are joining us this evening. Welcome everyone to RWAV 2025, the Victorian Rural Health Awards. I'm delighted to be a part of this evening's celebrations, recognising the extraordinary contributions you all make as hardworking rural healthcare professionals. Tonight's awards showcase those who have gone above and beyond to make a big impact on the health of rural Victorians. The nominees and finalists reflect the extraordinary work that the entire rural health workforce does every day. It's our healthcare workers that ensure communities in country Victoria receive the high quality, compassionate and culturally safe care that they deserve. Our government is committed to building the rural and regional health workforce by supporting local training pathways. We want to ensure that people can choose a career in rural health, knowing that they have just as much opportunity as those in metro areas. The local health services networks, which will be established on the 1st of July, are crucial to achieving this. RWAV continues to respond to the issues that impact the health system in rural Victoria, and I'd like to acknowledge their ongoing work to recruit, support and develop rural healthcare workers right across rural and regional Victoria. I look forward to continuing our strong partnership with RWAV moving forward. These 20th Victorian Rural Health Awards are all about celebrating your achievements, serving your rural communities. So to everyone joining from right across the state and on behalf of the Victorian Government, thank you for all you do, and I wish you all a wonderful evening.
Thank you, Minister Thomas. As we celebrate the achievements of our 2025 award recipients tonight, it's fitting that we reflect on the legacy of excellence that's brought us here on this 20th anniversary of the Victorian Rural Health Awards. Let's take a look back at the inspiring moments and remarkable contributions from the 2024 Victorian Rural Health Awards. Last year's event was a truly memorable celebration, shining a spotlight on the remarkable stories of healthcare professionals making a lasting impact in rural communities. From dedicated nurses and midwives to passionate doctors and allied health practitioners, the 2024 award recipients and nominees embodied the spirit of excellence and compassion and commitment that defines rural healthcare in Victoria. RWAV is dedicated to ensuring all rural, regional and Aboriginal and Torres Strait Islander communities in Victoria have access to quality healthcare, and we're inspired every day by your dedication to making that happen. And now it's my pleasure to introduce Ms. Lauren Caldwell, CEO of RWAV. Lauren has been a driving force behind RWAV's work to improve access to healthcare in rural and regional Victoria for many years. Her strategic leadership has led to the successful delivery of key reforms and innovative programs across primary care, general practice, Aboriginal and Torres Strait Islander health and community engagement, making a meaningful and lastful impact not only on RWAV but also on rural health. Please join me in welcoming Lauren Caldwell.
Good evening, everyone. To To all of you joining us from every corner of Victoria, I welcome you to the 20th Victorian Rural Health Awards. It's an honour and a privilege to be part of this milestone celebration in 2025 as we mark 2 decades of recognising the extraordinary individuals and teams who shape the story of rural healthcare in our great state. A heartfelt thank you to our sponsor, the Victorian Government, and to all of you for tuning in tonight. Your presence reflects the shared spirit and strength of our rural health communities. These awards are more than just recognition. They are stories of resilience, innovation, dedication, and compassion. Each award tells a story of someone who has made a profound difference in the lives of others. They are the narratives that define what it means to care for community, to show up in times of need, and to persevere through challenges. At RWAV, we are inspired by these stories and proud to honour the health professionals behind them. They are reminders of the impact rural health professionals have every day, often quietly, always meaningfully. Congratulations to every nominee and, of course, tonight's winners of the 20th Victorian Rural Health Awards. Enjoy the evening.
Thank you, Lauren. Now let's take a moment to hear some words from members of the wider community.
Congratulations, RWAV, on your 20th year of hosting the Victorian Rural Health Awards. We acknowledge all the hard work that you have undertaken in getting health professionals into the regional and rural communities where they're needed the most. Keep up the amazing work, and I love working with you.
Congratulations, RWAV, for celebrating 20 years of hosting the Victorian Rural Health Awards. Services for Australian Rural and Remote Allied Health acknowledge the incredible dedication of rural and regional health professionals who are always going above and beyond to improve health and wellbeing outcomes for their communities. Thank you, RWAV, for placing the spotlight on these incredible people, providing quality care where it is needed most.
Hi RWAV, it's Pat Giddings here. Congratulations to RWAV on 20 years of hosting the Victorian Rural Health Awards. I've been working in rural health for decades now, and I've seen firsthand the extraordinary dedication of rural and regional healthcare professionals. And these awards rightly celebrate those who go above and beyond to deliver high quality care where it's needed most. So thank you, RWAV.
Congratulations to RWAV for their 20th anniversary of the Victorian Rural Health Awards, and to all their winners for their outstanding contributions in rural and regional Victoria. Thank you very much.
Hi everyone, I'm Grant Phelps. It's my pleasure and privilege to be chair of the board of RWAV, and I'm here with some fellow directors and members of the RWAV team, and we're really pleased to announce the winners of the 2025 RWAV Rural Health Awards. This is the 20th year of our awards. We're really proud of them. We're really grateful for the work you do. Congratulations to all of our nominees and congratulations to all of our winners.
Congratulations!
As you watch tonight's awards, I invite you to take a moment to reflect on the incredible people who care for our rural and regional communities. The next time you see your local nurse, GP, allied health professional or support worker, let them know that their dedication doesn't go unnoticed. A simple thank you can mean the world. Each nominee and award recipient has walked a unique path, yet they are united by a shared commitment to improve the health and wellbeing of their communities with the utmost care and excellence. This year, we're proud to recognise outstanding contributions across 13 award categories, including Length of Service Award, as well as outstanding contribution in the following rural categories: Medical Specialist, Aboriginal and Torres Strait Islander Health, Rising Star, Multidisciplinary Team, Allied Health, Outreach Provision, Practice Management, Consumer Advocate, Primary Care Nurse or Midwife, GP or Rural Generalist, Mentor or Supervisor. And this year, we're delighted to introduce a new category, the Outstanding Contribution by an RWAV Student Ambassador Award. Now, let's celebrate the remarkable achievement of the 2025 Victorian Rural Health Award recipients. Let's begin the evening by celebrating one of the highest honours of the Victorian Rural Health Awards, the Length of Service Award. This award recognises over 35 years of dedication to rural healthcare. It honours those who have delivered exceptional care while becoming trusted, long-standing pillars in their communities. Presenting this award are Professor Grant Phelps, Chair of the RWAV Board, and Mrs Kate Temby, RWAV's General Manager of Strategy and Partnerships. Grant is a respected gastroenterologist and acute physician with over 25 years of service in regional Victoria. He also advises healthcare organisations nationally on leadership, workforce and quality care. Kate is a registered nurse who brings extensive experience across government and community health. Her work has driven innovative programs that improve healthcare access throughout rural Victoria. Please welcome Professor Grant Phelps and Mrs Kate Temby to the stage as we honour the 2025 Length of Service Award recipients.
Good evening. It's a privilege to stand before you tonight to honour a remarkable group of individuals whose dedication has shaped the very fabric of rural and regional healthcare in Victoria. The Length of Service Award recognises doctors who have devoted more than 35 years to their communities, often serving as the cornerstone of care, guidance and support. These clinicians are not only healthcare providers, they have stood the test of time, responding to every call with unwavering commitment.
Yes, 35 years of service is an extraordinary milestone. They've played a vital role in keeping their communities healthy, supported and connected. Tonight we honour their legacy of care and the difference they continue to make across rural Victoria. It is our great honour to present the 2025 Length of Service Award recipients.
Let's acknowledge the extraordinary commitment of these medical specialists and specialist GPs who are receiving the Length of Service Award for over 35 years of service to their communities. Dr Andrew Galt from the Port Fairy Medical Clinic in Port Fairy, Dr Daryl Smith from the McLeod Street Medical Centre in Bairnsdale, Dr David Monash from Inglis Medical Centre in Sale, Dr David Wilson from Lister House Medical Clinic in Horsham, Dr Elizabeth Quinn from Springs Medical Centre in Dalesford, Dr Ernan Hessian from Swan Hill Primary Health Medical Centre in Swan Hill, Dr Gavin Frawley from Ovens Medical Group in Wangaratta, Dr Gerard Brownstein from Benalla Church Street Surgery in Benalla, and Dr Gregory Stewart from Springs Medical Centre in Dalesford. Dr Hugh Chisholm, Leongatha Healthcare and Gippsland Southern Health Service in Leongatha, Dr Ian Sutherland from Port Fairy Medical Clinic in Port Fairy, Dr Janice Baker from Broadford Medical Clinic in Broadford, and Dr John Guymer from Wyndham House Clinic in Shepparton.
Additionally, we also have Dr Mary Holland, Flora Hill Medical Centre, Flora Hill, Dr Nicholas Kimpton, Ballarat Medical Centre, Ballarat, Dr Peter Hales, Surf Coast Medical Centre, Torquay, Dr Peter Hall, Kyabram Regional Clinic in Kyabram, Dr Peter Rogers, Healesville Medical Centre, Healesville, Dr Robert Dawson, Latrobe Regional Health, Traralgon, Dr Ross Steiger, Bairnsdale Medical Group, Bairnsdale, and for the first time we are honouring the dedicated years of service contributed by allied health professionals. They are Ms Kerry Thompson, Hallmark Integrated Health Services in Bairnsdale, and Mrs Leslie Robinson, West Wimmera Health Service, Nil.
Congratulations to all of our deserving recipients of the Length of Service Award, and thank you for your ongoing service to your communities.
Thank you, Grant and Kate. And now, to present the next award, please welcome the 2024 recipient of the Outstanding Contribution by a Rural Medical Specialist Award, Dr Adam Straub. Adam is an addiction medicine physician and general physician. He's also the only addiction medicine physician in regional Victoria, playing a vital role across Grampians Health Service, St John of God Ballarat and Ballarat Community Health, where he leads the region's opioid management clinic. Adam, it's a pleasure to have you back. Please reveal the recipient of this year's Outstanding Contribution by a Rural Medical Specialist Award.
Thank you, RWAV, for inviting me to be part of this special occasion. Winning the award last year was an encouraging recognition of the work I do in regional Victoria. It helped spread the word about my clinic and will hopefully be leading to a major expansion in our services in coming months. The Outstanding Contribution by a Rural Medical Specialist Award recognizes a rural non-GP specialist who has shown ongoing commitment to providing exceptional care to the community. Nominees for this award must be providing medical specialist care in a hospital and/or community setting. Ladies and gentlemen, let's give a big round of applause to all the worthy finalists in this year's Rural Medical Specialist category on screen. And now it gives me great pleasure to present the 2025 Outstanding Contribution by a Rural Medical Specialist Award to the winner, Dr. Ruwangi Udayasiri, Goulburn Valley Health and Shepparton Women's Health Centre, Shepparton. Dr. Ruwangi Udayasiri is the only female general surgeon and breast surgeon serving a network of rural hospitals across Shepparton, Kyabram, Echuca, and beyond, delivering expert care in breast, endocrine, and laparoscopic surgery to communities that would otherwise go without. With advanced surgical training and a commitment to accessible, high-quality cancer care, RU brings specialist services closer to home for countless regional patients. She is also a passionate educator, researcher, and public health advocate, mentoring future surgeons, leading research into better surgical outcomes, and empowering rural women through breast cancer awareness and health education. She is a true leader, change maker, and role model in her field. Ru, thank you for all you do, and congratulations.
Thank you, Adam, and congratulations, Ruwangi. Now let's hear from Dr. Ruwangi Udayasiri.
I'm truly honoured to receive this award. It not only recognises my personal efforts, but the incredible work of the team at Goulburn Valley region. Supporting breast cancer patients in our rural communities has been both a challenge and a passion. Whether it's in theatres, clinics or via telehealth, we've worked very hard and tirelessly to bring quality care close to home. I'd like to thank the GPs at Kyabram District Health for this nomination and for RWAV for this incredible recognition. I'm inspired to expand our services, especially breast screen access, for early detection and improving outcomes for this region. Thank you.
The next award we celebrate is the Outstanding Contribution to Aboriginal and Torres Strait Islander Health Award. To present this award, I'm honoured to welcome last year's recipient, Ms. Shannon Balfour. Shannon is a proud First Nations woman and the manager of the Woongi unit at Rumbalara Aboriginal Cooperative in Shepparton, Marupna. Under her leadership, Woongi has expanded group yarning sessions, clinical care and community engagement while forging strong partnerships with mainstream services and education providers. Please join me in welcoming Shannon to announce the 2025 winner of the Outstanding Contribution to Aboriginal and Torres Strait Islander Health Award.
Thanks, Ellen. For me, receiving this award was an incredibly humbling and meaningful moment. It not only acknowledged years of dedication and collaboration with communities, but also affirmed the importance of culturally safe, community-led approaches to health and wellbeing. The Outstanding Contribution to Aboriginal and Torres Strait Islander Health Award recognises a health professional, team or organisation that has made significant contributions in providing care to Aboriginal and Torres Strait Islander clients and communities. The award recognises both medical and non-medical workers and includes specialists, counsellors, health workers, nurses and many more. Here are the finalists for the Outstanding Contribution to Aboriginal and Torres Strait Islander Health Award. Such a deserving field of finalists. Now let's turn our attention to the 2025 Outstanding Contribution to Aboriginal and Torres Strait Islander Health Award winner, Dr. David Batovic. Please give a warm round of applause. Dr. David Batovic is a cardiologist who travels over 4 hours each way every month to provide specialist care and mentorship to the Aboriginal community at Gippsland and East Gippsland Aboriginal Cooperative in Bairnsdale, a commitment he's upheld for years without hesitation. What sets David apart isn't just his clinical skill, it's his quiet consistency, cultural humility, and genuine belief in health equity. He shows up, listens deeply, and empowers others to do the same. His mentorship of 2 young Aboriginal health practitioners has transformed clinic care, with a pre-cardiology program now led by Aboriginal health practitioners who deliver culturally safe care with confidence and professionalism, a lasting legacy of his support. David's work is heartfelt, impactful, and deeply respected. A cardiologist whose dedication goes far beyond the clinic. Congratulations on this well-deserved recognition, Dr. David Batovic.
Thank you, Shannon. Amazing work, David. Now, let's hear from Dr. David Bertovich.
Thank you for this award, which recognises the clinical work I do in Aboriginal health centres in Bairnsdale, Mildura and Robinvale. I'm a cardiologist based in Melbourne, and I took up the opportunity to provide an outpatient cardiology clinical service to Aboriginal health centres in Mildura and Robinvale about 14 years ago, and I started a similar clinic in Bairnsdale about 9 years ago. Now, this means I'm away from home at least once a fortnight, which is hard, but I know that my family support me with this, which I know is rewarding in itself. My children are old enough now to understand the reason I do these things, and that in itself is great, but this award goes a long way to proving to me that these efforts are also valued by my patients and my peers. It's quite rare for patients to show sincere gratitude. And every time a patient does actually go out of the way to thank me, I thank them in return and explain that we, as health professionals, really do appreciate these comments and feedback, because it really is what keeps us going. This nomination and award is, in many ways, a thank you on a much bigger scale. So I thank, in return, the Rural Workforce Association for their recognition. I'd like to also thank the nurses, health practitioners, GP and support staff, and the Gippsland and East Gippsland Aboriginal Co-op in Bairnsdale, the Mallee District Aboriginal Health Service in Mildura, and the Murray Valley Aboriginal Co-op in Robinvale for the ongoing support they provide to me and our patients. I implore all of you to continue the good work you do in rural Victoria and to share your experiences with your colleagues. Tell them about how much demand there is. Tell them about your experiences and tell them how rewarding it is. Thank you.
Young professionals like our next presenter represent the bright future of rural healthcare, bringing fresh perspectives, deep compassion and a strong sense of community to their work. The Rising Star Awards celebrates those early in their careers who are already making a significant impact. One such individual is Dr. Felix Ritson, GP Registrar at Lister House Clinic in Horsham and last year's Rising Star Award winner. Passionate about rural medicine, Felix has shown outstanding commitment to patient care, particularly in mental health and complex cases involving substance dependence. He's also actively involved in mentoring students and supporting youth health through the Doctors in Schools program and engaging with community initiatives like Men's Shed and Men's Talk. Please welcome Dr. Felix Ritson to present this year's award.
Thank you, Ellen. Receiving the Rising Star Award last year meant a great deal to me. It was very encouraging and motivating, and I feel represents the type of support one receives working in rural healthcare. Since then, I've fallen more in love with the Wimmera community and land and look forward to continuing to contribute to the well-being of this part of Australia. One of the keys to ensuring the longevity and enrichment of rural healthcare is the new generation of up-and-coming health professionals. Their passion, energy and eagerness to immerse themselves in rural communities, to live and breathe the rural lifestyle, will not only sustain but also transform rural healthcare, making services more accessible in the future. Let's acknowledge the Rising Star Award finalists. Congratulations, Mr. Jemuel Price. An incredible achievement. We look forward to seeing your continued impact. Jemuel is a physiotherapist who brings heart, talent and dedication to every aspect of his practice. Since graduating in 2022, he has already made a remarkable impact as a physiotherapist on the Bellarine Peninsula. He leads the Good Living with Arthritis program for people with hip and knee osteoarthritis, often running 2 groups at once. He has guided over 50 patients through this life-changing 7-week course. Beyond musculoskeletal care, Jemuel also works with special needs children twice a week, blending physiotherapy with his musical gifts to support and uplift his young clients. Committed to rural health, community to connection, and compassionate care, Jemuel is truly a rising star. Please join us in celebrating Mr. Jemuel Price, winner of the Rising Star Award. Congratulations.
Thank you, Felix, and congratulations to Jemuel, a very worthy winner. Let us now hear from Mr. Jemuel Price.
Well, thanks so much. I'm honoured to receive this award. Funnily enough, I'm in my workplace right now about to run an exercise group called the GLAD program, and it was RWAV that funded this through a grant, funded my training. So very thankful for the support from RWAV with these awards and also with the grants and just the way that you support rural clinicians like myself. So thank you to RWAV and thank you to my fellow clinicians at Allied Physiotherapy. Thanks.
Our next award is for outstanding contribution by a rural multidisciplinary health team. Multidisciplinary teams are the forefront of a more connected and comprehensive care model, bringing together a diverse range of skills to deliver holistic, coordinated care. Through collaboration and innovation, these teams play a vital role in improving patient outcomes across regional Victoria. To present this award, I'm pleased to welcome Ms. Rosalind Bloomer from the PACE team at Alpine Health, one of last year's recipients. Rosalind is the nurse coordinator of the PACE team, which delivers cardiac and pulmonary rehabilitation across Bright, Mount Beauty and Myrtleford. Despite being a small team, their impact has been mighty, supporting over 700 participants, reducing hospital admissions for COPD and improving lives through flexible, community-based and telehealth care. Please join me in welcoming Rosalind to the stage to announce the 2025 winner of the Outstanding Contribution by a Rural Multidisciplinary Health Team Award.
Thank you, Alan. We were so pleased and humbled to have won this award last year. Recognising the work of our small rural team and the broader impact on not just the individuals but the health outcomes for the whole community is incredibly empowering. In rural healthcare, multidisciplinary teams exemplify a progressive model of integrated care, bringing together practitioners from various health disciplines to deliver more comprehensive and patient-centred outcomes. Let's hear it for the exceptional individuals nominated in this category. I am pleased to announce that the 2025 winner of the Outstanding Contribution by a Rural Health Multidisciplinary Team is the Ontario Medical Clinic, Mildura. The team at Ontario Medical Clinic is transforming one of the most complex areas of primary care, long-term opioid use. At Ontario Medical Clinic in Mildura, a collaborative team led by GP pharmacist Mrs. Brooke Shelley and GP registrar Dr. Ryan Sheridan developed the chronic opioid cycle of care, an innovative patient-centred model supporting people living with chronic pain and an opioid dependency. This program brings together GPs, nurses, pharmacists and addiction medicine specialists to deliver safer, more accessible care right to where patients live. From structured reviews and in-house medicines, assessments to telehealth case conferencing with specialists, this model not only improves health outcomes, but also builds local workforce capacity and breaks down traditional barriers in rural healthcare. It's a shining example of how multidisciplinary teams can lead real systematic change.
Thank you, Rosalind. And now we have a message from Mrs. Brooke Shelley on behalf of the Ontario Medical Clinic, Mildura.
Hi, I'm Dr. Ryan Sheridan, GP Registrar at Ontario Medical Clinic in Mildura.
And I'm Brooke Shelley, the GP Pharmacist, and tonight we are proudly representing the whole team at Ontario Medical Clinic in receiving this award.
This award reflects the strength of our team in delivering coordinated care through the development of the Chronic Opioid Use Cycle of Care program.
A big thank you to our GPs, nurses and admin staff. Here at OMC, multidisciplinary care is not a buzzword. We know that it is the future of patient-centred care.
Finally, thank you to RWAV for recognising the power of multidisciplinary rural teams working together, improving access and outcomes one patient at a time.
Thank you.
Our next award category is the Outstanding Contribution to Rural Allied Health Award, which recognises an allied health professional who has gone above and beyond to support and care for rural and regional communities. To present this award, please welcome last year's recipient, Ms. Jessica Moller. Jessica is the lead clinician for occupational therapy at Gippsland Lakes Complete Health. She brings extensive experience in delivering innovative, community-focused OT services across rural and remote East Gippsland. From supporting bushfire recovery efforts in Malakuta to leading outreach clinics in partnership with Bush Nursing Services, Jessica has made a lasting impact on access to care. She's also played a key role in developing Gippsland's OT workforce through a cadetship program. It's a pleasure to have her back with us this evening. Please join me in welcoming Jessica to the stage.
It is a pleasure to return this year to present the Outstanding Contribution to Rural Allied Health Award. Receiving this award last year was both a privilege and an honour, and I'm delighted to return to present this award to a worthy recipient. The Outstanding Contribution to Rural Allied Health Award is a prestigious recognition that shines a spotlight on the remarkable work of allied health professionals and the crucial role that they play in improving the health outcomes across rural Victoria. Once again, we received a strong field of nominations reflecting the depth and dedication and impact being made across communities right across the state. And now, I'm delighted to introduce the finalists for the Outstanding Contribution to Rural Allied Health Award. It is my absolute honour to announce that the winner of this year's Outstanding Contribution to Rural Allied Health Award goes to Mrs. Leslie Robinson. For nearly 40 years, Leslie has been at the heart of diabetes care in the West Wimmera region. Through her compassionate, patient-focused approach, Leslie, a credentialed diabetes educator, has empowered countless individuals to take control of their health, transforming lives and reshaping how diabetes education is delivered in rural communities. But her impact goes far beyond the consulting rooms. As a mentor and leader, she has trained and inspired the next generation of diabetes educators, embedding a culture of excellence and innovation at West Wimmera Health Service. In a rural setting, professionals like Leslie, who bring deep expertise, unwavering dedication and genuine care, are rare and invaluable. Please join me in celebrating Leslie for her exceptional contributions to rural allied health and her dedication to expanding access to essential services and support within her community. Congratulations, Mrs. Leslie Robinson.
Thank you, Jessica. Fantastic work, Leslie. Let's hear directly from Mrs. Leslie Robinson, who has a few words to share.
I'm Leslie Robinson. This award has taken me completely by surprise. I'm both honoured and humbled to firstly be nominated and secondly to actually be accepting it. For much of my career, I've been fortunate to work for an organisation that is truly dedicated to providing high quality healthcare to all the rural communities of the Wimmera Mallee that we serve. I've also been lucky to work with a wonderful diabetes and allied health team who are committed to ensuring that our clients receive the outstanding care that they all deserve. I'd like to thank West Wimmera Health Service for the nomination and to the colleagues who supported it. To the Rural Workforce Agency, thank you for all the work you do to support the efforts of those in the rural health setting whose work is so very much needed. Most of all, I'd like to thank my clients who have put their trust in me on a daily basis as we work together to achieve the best possible outcomes in their diabetes journey. And last but not least, thank you to my family, who's always giving me unwavering love and support.
Next, we present the Outstanding Contribution to Rural Outreach Provision Award, which honours a health professional, team or organisation making a significant impact through outreach services in rural and regional communities. To present this award, please welcome last year's recipient, Dr. Stephen Tudge. Stephen is a dedicated ENT specialist whose work has greatly improved ear health outcomes for communities in Gippsland. He regularly visits Bairnsdale and Sale to provide vital care, particularly for young children. He also ensures access to essential surgical interventions via bulk billed pathways. Stephen's ongoing commitment is deeply valued by local Aboriginal community-controlled organisations and the communities he serves. It's wonderful to have you back with us for this special occasion, Stephen.
Good evening. I'm honoured to return this year to present the Outstanding Contribution to Rural Outreach Provision Award, recognition of a passionate health professional whose commitment to outreach is transforming lives in rural and regional communities. These dedicated individuals travel beyond the city limits to bring vital health care to those who need it most, often serving as the only lifeline for patients who would otherwise go without timely care. Let's take a moment to acknowledge the outstanding finalists for this year's award. And now, it is my great pleasure to announce the winner of the 2025 Outstanding Contribution to Rural Outreach Provision Award, Dr. Julian Yeo. Specialist heart care in rural communities is a little bit more accessible thanks to Julian, an interventional and structural heart disease cardiologist. Through the Visiting Cardiology Outreach Service, part of the Healthy Hearts program, Julian travels from Melbourne to Myrtleford to deliver in-person cardiology clinics, bringing critical bulk billed care to patients who would otherwise have to travel hours for treatment. Each clinic includes on-the-spot echocardiograms performed by cardiac sonography using portable equipment, giving patients a full cardiac workup and diagnosis, all in a single visit. Since launching in July 2024, the program has already delivered over 40 cardiology appointments and echocardiograms, transforming access to specialist care in the region. Beyond the clinic, Julian's commitment is clear, sharing his expertise with the wider community at public education events like the Healthy Hearts Community Talk, attended by over 80 locals. For their dedication to rural health and truly patient-centred outreach, I'm proud to present the Outstanding Contribution to Rural Outreach Provision Award to Dr. Julian Yeo.
Thank you, Stephen. And now we have a message from Dr. Julian Yeo.
Hi everyone, Julian Yeo here. I wanted to say how truly honoured and excited I am to receive the Outstanding Contribution to a Rural Outreach Provision Award. It means so much to me, both personally and professionally. So far, working in the rural communities has been one of the most rewarding parts of my journey. I feel so privileged to support patients who often face challenges accessing consistent, timely and quality cardiac care. I'm deeply passionate about improving health outcomes in this area, and so a big heartfelt thank you to RWAV and my peers, especially Justin and Greta Donaldson and the team at Alba Health in Myrtleford, and everyone involved in the Healthy Hearts program who have nominated me for this award. Your collaboration and shared commitment continue to inspire me every day. A further thank you to the incredible community of the northeast of Victoria, including Northeast Health Wangaratta, Ramsay Health, your staff, the local GPs and allied health professionals, and of course my team in Melbourne and to the Austin Hospital for their ongoing support. Finally, a big thank you to my wife and my family for their constant understanding and support as I achieve everything I'd like to in an outreach setting. Thank you so much everyone and enjoy the night.
We now turn our attention to the vital role of practice management in rural and regional health services. The Outstanding Contribution to Rural Practice Management Award honours a practice manager who has gone above and beyond their role, demonstrating exceptional leadership, mentoring and innovation, along with a deep commitment to the health and wellbeing of rural and regional communities. To announce the finalists and the winner, please welcome Mr. Ben Trewarn. Ben is the team manager of health professional recruitment at RWAV, where he leads a dedicated team working tirelessly to connect rural and regional towns with the healthcare professionals they urgently need. Let's give a warm round of applause for Ben.
Thank you, Ellen. Good evening to everyone watching the awards tonight. Please give a big round of applause to all the 2025 Outstanding Contribution to Rural Practice Management Award finalists. It gives me great pleasure to announce the winner of the Outstanding Contribution to Rural Practice Management Award 2025, Mrs. Rachel Hazapoulis. As a practice operations manager for 6 general practices, 3 rural and 3 metro, Rachel has spent over a decade transforming rural primary care delivery. In 2020, she founded the Ashbury Street Medical Centre in Trafalgar, a much needed bulk billing clinic that remains one of the few in the region. Under her guidance, the practice has grown to 11 GPs and a full nursing and admin team. It offers comprehensive services including podiatry, audiology, dietetics and sleep studies without patients needing to travel to Melbourne. Rachel's impact extends far beyond the clinic walls. She's opened 2 additional rural practices, built multidisciplinary care teams, and continues to advocate for GP workforce support, training, and equitable access. Her efforts have earned her national recognition, including the AAPM Practice Manager of the Year award. Congratulations, Rachel, for your tireless dedication, community spirit, and outstanding contribution to rural practice management.
Thank you, Ben. Let's give a huge cheer and a round of applause to Mrs. Rachel Hazapoulis.
Hi, I'm Rachel Hatzopoulos and I'm honoured to accept the award for Outstanding Contribution to Rural Practice Management for 2025. I would like to acknowledge my fellow peers and those working in general practice. I would also like to thank my family for giving me purpose, love and strength. I would like to thank my outstanding work family, my team. You guys are amazing. I'm truly blessed to work with such an exceptional team of people every day. I would also like to thank those that have supported me throughout my career. None of this would have been possible without you. Thanks to RWAV for recognising the dedication and commitment of health professionals working in rural Victoria. Congratulations to all of the award winners and thank you.
Next, we turn to a very special honour, the Outstanding Contribution by a Rural Health Consumer Advocate Award. Unlike our other categories, this award celebrates individuals who are not health professionals, but whose influence on rural healthcare has been extraordinary. It recognises consumers, carers and community members from rural Victoria who have drawn on their lived experience to work alongside health services and professionals, improving the quality, safety and accessibility of care in their communities. Through advocacy, collaboration and courage, these individuals shine a light on rural health challenges and give voice to those who might otherwise go unheard. Their efforts empower communities, strengthen services and drive meaningful grassroots change. To join me in presenting this important award, I would like to welcome Mr. Shay Matsakanda. Shay is the General Manager of Finance and Risk at RWAV, with over 2 decades of leadership experience in the commercial and not-for-profit sectors across Australia and the UK. He is passionate about creating systems that support equitable access to healthcare in rural and regional areas.
Thanks, Ellen. This award is especially meaningful because it honours the power of lived experience, the deep insight that only a patient, carer and community member can offer. Consumer advocates are the vital link between health systems and the people they serve. They challenge, guide and inspire change, ensuring healthcare is not only effective but also compassionate, respectful and inclusive.
The finalists for the 2025 Outstanding Contribution by a Rural Health Consumer Advocate Award have shown incredible dedication to making rural healthcare better for everyone. And they are Each of our finalists has made a powerful impact, and we thank them both for their tireless advocacy and leadership.
And now, I'm honoured to announce the winner of the 2025 Outstanding Contribution by a Rural Health Consumer Advocate Award, Mrs. Sally Fraser. Sally, from the Violet Vines Marshland Centre for Rural Health Research in Bendigo, has spent years championing the needs of patients, carers, and families across the Loddon-Mallee region. From her leadership roles on the Loddon-Mallee Regional Clinical Council to chairing key consumer engagement initiatives, she has brought consumers and clinicians together to drive better care. A pioneer in her field, she was also among the first health consumers trained by Safer Care Victoria to sit on Sentinel event review panels, helping health teams communicate with clarity, empathy, and respect. Sally is also a highly regarded researcher, contributing to projects on pandemic impacts, skin cancer care, and the role of consumers in health research, always amplifying the community's voice in the evidence. We're proud to honor Mrs. Sally Fraser for her unwavering advocacy, her leadership, and the profound legacy she continues to build. Congratulations, Sally.
Thank you, Shay. Congratulations to Sally. And now let's hear from Mrs. Sally Fraser.
Thank you. I was so thrilled to be nominated for this award, but then to hear that I'm actually the winner of the 2025 Outstanding Contribution by a Rural Health Consumer Advocate Award, I'm amazed and humbled. I've always been a volunteer in education, music, and for the past 12 years or so in health. I feel that I've had the opportunity to give back to my community in my roles across Loddon-Mallee, Bendigo, and lately Barwon Health as well. I enjoy research roles with Latrobe Rural Health School and am in constant awe of all the professional clinicians and academics I encounter. I thank all those who kindly and patiently work with me. I value your time, expertise, and dedication to rural health care and education. Lastly, I particularly want to thank the Rural Workforce Agency Victoria for their work in sponsoring these awards. Thank you.
Our next category is the Outstanding Contribution by a Rural Primary Care Nurse or Midwife. This award recognises an exceptional nurse or midwife working in rural or regional Victoria who consistently goes above and beyond in delivering high-quality patient care and improving health outcomes in their community. To announce the 2025 winner, we're delighted to welcome back last year's award recipient, Ms. Robin Butler, Clinical Nurse Manager at Inverloch Healthcare. Robin has been a dedicated rural nurse since 1984, known for her leadership, advocacy, and heartfelt connection to her patients. She continues to inspire those around her through her deep commitment to rural healthcare. It's wonderful to have you with us again, Robin.
Thanks, Ellen. Wow, a year, just about, since I received this award. Doesn't seem that long. It was a thrill to receive this award and be recognised by my colleagues and peers, and meant a great deal. But the thing I hadn't counted on was how much the community, my local community, were excited by it and thrilled by it and what it meant to them. So that was a surprise and a wonderful one. Nurses and midwives are the backbone of rural healthcare in Victoria. They're often the first point of contact for patients, providing essential primary care, emergency support, and chronic disease management, all while building strong, trusted relationships with their communities. It's my pleasure to recognise the outstanding finalists for the 2025 Outstanding Contribution by a Rural Primary Care Nurse or Midwife Award. I'm so pleased to announce that the winner of the 2025 Outstanding Contribution by a Rural Primary Healthcare Nurse or Midwife is Mrs. Kate Worsfold. For decades, practice nurse Mrs. Kate Worsfold has been a cornerstone of Kyabram Regional Clinic, an advocate for women's health and a mentor to generations of healthcare professionals. She's led cervical screening services in the region, ensuring thousands of women receive timely, supportive and expert care. Kate's commitment to lifelong learning in women's health, wound care and infection control has kept her at the forefront of clinical excellence. But it's her warmth, her mentorship and unwavering dedication to her patients and team that truly set her apart. Kate is a nurse whose dedication, leadership and compassion have shaped the health of the local community. Well done, Kate. An award so deserved. Thank you so much for your outstanding service and enjoy your 2025 year.
Please put your hands together for Robin. I now invite Mrs. Kate Worsfold to share a few words.
Thank you so much. I'm absolutely thrilled and honoured to receive this award. It's incredibly meaningful to be recognised for the work I care so deeply about. I'm passionate about women's health, and over the years I've focused on raising awareness around cancer screening and supporting the education of my fellow colleagues. Thank you to my amazing team at the Kyabram Regional Clinic for the nomination and to RWAV for this incredible recognition.
It's now time to recognise the vital role of rural GPs and generalists in delivering healthcare where it's needed most. The Outstanding Contribution by a Rural GP or Rural Generalist Award honours a physician who provides exceptional, comprehensive care across general practice, emergency and specialist services, meeting the unique needs of their rural community. To announce this year's winner, please welcome last year's winner, Dr. David Wilson. David has spent over 34 years serving the Horsham community as a GP, obstetrician, educator and mentor. He's been involved in more than 10,000 births, trained countless healthcare professionals and supported his community through various roles, including being a police surgeon. His commitment and care have made a lasting impact across the Wimmera region. Please join me in welcoming Dr. David Wilson to deliver this award.
Okay. Good evening, everyone. I was excited to win the award last year, and since then I've been focusing on encouraging the up-and-coming generation. Rural GPs and rural generalists are the trusted and steady presence of healthcare across Victoria's rural and regional areas. They stand at the front line, caring for everyday ailments, navigating medical emergencies, managing complex situations with skill and compassion. The presence brings certainty where resources are few, weaving a vital thread through the fabric of rural life. Please give a big round of applause for the finalists. And now for the winner of the Rural GP or Rural Generalist Award, Dr. Gregory Hayes. Dr. Gregory Hayes has spent over 27 years serving Lakes Entrance, and even at 76 he remains the first to arrive, the last to leave and always on call, ready with his doctor's bag, whether in the clinic, on the golf course or out in the community. Gregory's career spans decades and borders, from inner Melbourne to remote Northern Territory, where he delivered compassionate care in some of the most challenging settings. A trusted doctor, a mentor to countless learners, and deeply valued member of the community. He's known for going beyond the consultation room, making home visits, supporting families, attending funerals, and always finding time for his patients. His dedication, humility, and tireless service have defined what it means to care for a rural community. Well done, Gregory.
Let's take a moment to hear from Dr. Gregory Hayes, this year's Deserving Award recipient.
Hi, I'm Dr. Greg Hayes, General Practitioner in Lakes Entrance. I'd like to thank RWAV very much for this award. It's quite exciting. I had no idea I'd been nominated, and it's the first award I've received. I'm a Monash graduate from 1971, and after working for a couple of decades in Melbourne, I became a rural locum throughout Victoria and southern New South Wales, and then I did 4.5 years as a rural locum in the Northern Territory, from the islands to the central desert, just in Indigenous communities. And then I came to Lakes Entrance in 2006, and I've been there ever since. Thanks again very much to RWAV.
Next, we present one of our most inspiring honours, the Outstanding Contribution by a Mentor or Supervisor Award. This award celebrates the dedication and influence of mentors and supervisors who guide, support and shape the next generation of health professionals. By recognising a mentor or supervisor in medicine, allied health and nursing, we aim to strengthen and sustain the rural health workforce across Victoria. To help us present this award, please welcome last year's recipient, Associate Professor Shabna Rajapaksa. Shabna is a respected paediatrician and co-head of paediatrics at Grampians Health, as well as Deputy Director, Sub-Dean for Medical Student Education at the University of Melbourne's Rural Clinical School in Ballarat. Through her clinical leadership and commitment to education, she has made a lasting impact on rural health training and inspired countless future practitioners. Please join me in welcoming Shabna to the stage.
Thank you, Ellen, and greetings to everyone tuning in from across Victoria. It was a privilege to be the inaugural recipient of this award. Mentorship and supervision enable a strong and sustainable health workforce. In rural and regional Victoria, where healthcare professionals often work in challenging and isolated environments, mentors and supervisors offer more than just guidance. They provide inspiration, connection, and practical wisdom. Their support helps emerging professionals grow in skill and confidence, ensuring quality care reaches even the most remote corners of our state. Let's take a moment now to celebrate the finalists for the 2025 Outstanding Contribution by a Mentor or Supervisor Award. It is my great pleasure to announce that the 2025 Outstanding Contribution by a Mentor or Supervisor Award goes to Dr. Mehdi Senatipur. General Practitioner Dr. Mehdi Senatipur is a beacon of support and leadership in Mildura and Red Cliffs. As a supervisor at Sunraysia Medical Centre, his teaching style is thoughtful, insightful and tailored to every learner, empowering trainees to grow with confidence and purpose. Mehdi's mentorship goes far beyond medicine. He offers guidance on career development, research and regional practice, always with genuine care and encouragement. His dedication to the community is equally inspiring. From launching after-hours GP services, caring for nursing home residents, volunteering at health events and mentoring future medical students, a role model in every sense. Congratulations.
Thank you, Shabna. Let's give a warm round of applause as Dr. Mehdi Senatipur joins us.
My name is Mehdi Senatipur. I'm a GP and supervisor at Sunraysia Medical Centre in Red Cliffs, Northwest Victoria. Being nominated for RWAV's Outstanding Contribution by a Supervisor's Award is truly incredible. Just to be considered by my registrars means so much to me. I'm deeply honored and humbled to receive this recognition. I would like to extend my gratitude to my past and present registrars for this nomination, as well as our amazing practice team whose support helped us deliver high-quality teaching every day. A special thanks to RWAV for organizing this award and for their ongoing commitment to strengthening rural general practice. This recognition inspires me to continue striving for excellence in teaching, nurturing next generation of GPs who will shape future of healthcare in rural Victoria. Thank you.
We're excited to introduce a brand new honour tonight, the Outstanding Contribution by an RWAV Student Ambassador Award. This inaugural award recognises a current health student or recent graduate who's shown exceptional commitment to rural and regional healthcare in Victoria. It celebrates those who advocate for rural communities, promote rural practice, and inspire their peers to pursue careers where they're needed most. To present this award, I now invite Ms. Karina Princey, Manager Strategy and Partnerships at RWAV. With over 30 years of experience across health, non-profit, research and government sectors, Karina leads grants, workforce development and allied health strategy at RWAV, with a strong focus on improving healthcare access across rural and regional Victoria. Please make welcome Karina.
Thanks, Ellen, and hello to everyone tuning in from all corners of Victoria. Tonight, we are proud to present the Outstanding Contribution by an RWAV Student Ambassador Award for the very first time. This inaugural award celebrates the outstanding efforts of RWAV student ambassadors, emerging health professionals who go beyond their studies to champion rural and regional healthcare in Victoria. Through advocacy, outreach and peer engagement, they help promote rural careers, support local communities and inspire their peers to follow a rural health pathway. Let's now acknowledge the finalists for the 2025 Outstanding Contribution by an RWAV Student Ambassador Award. I am delighted to present the inaugural RWAV Student Ambassador Award to Ms. Stacey Dowen. Stacey, a Bachelor of Occupational Therapy honours student at Deakin University Geelong, has gone above and beyond in her role as an RWAV Student Ambassador, presenting at conferences across Victoria and Australia, advocating for inclusive care for neurodiverse and culturally diverse communities, and inspiring rural students to see themselves in healthcare careers. Clinically, Stacey has spent over 2 years supporting ageing and neurodiverse populations across regional Victoria, bringing empathy, cultural sensitivity and energy to every role. Beyond the clinic, she's a tireless advocate and community leader. Whether it's co-founding student groups, leading TEDx events, or empowering migrant communities in Geelong. Stacey's work embodies the spirit of rural health advocacy, leadership and care. Congratulations, Stacey.
Thank you, Karina. Such a well-deserved recognition. Please welcome Ms. Stacey Dowen to share a few words.
Hi everyone. It is my honor to receive the Outstanding Contributions of the RWAV Student Ambassador Awards. For the past 2 years, I've had the privilege of serving the rural communities of Colac, Anglesey, and Torquay as an allied health assistant of residential aged care, all while completing my studies in occupational therapy. This award is a reminder for me and for other students as well, that as students, we are capable of making so many difference in so many lives. Thank you to the RWAV, to my peers, my mentors for the opportunity. Thank you.
Joining me once more is Ms. Karina Princey. Karina, this year marks 20 years of the Victorian Rural Health Awards. What are your reflections on tonight?
It's been an inspiring evening, Ellen. Celebrating this milestone reminds us how deeply rural health professionals are valued. The calibre of winners and the sheer number of nominations speak volumes about the impact they have in their communities.
And what a celebration of representation. Finalists from every corner of rural Victoria, from Edenhope to Bairnsdale, Redcliffs to Lakes Entrance, Portland to Wodonga, and the many smaller towns in between have shown that dedication knows no boundaries. These awards don't just recognise excellence, they honour the heart and soul of rural healthcare and help inspire the next generation of leaders.
Absolutely. We've seen resilience, innovation and a powerful sense of community spirit tonight. A heartfelt thank you to our judging panels, to everyone who submitted a nomination and to all our incredible nominees. And to the quiet achievers behind the scenes, admin teams, receptionists, cleaning crews, your work makes everything else possible. We see you and we thank you. Congratulations to all the winners, finalists and the communities that support them.
Thank you, Karina. And thank you to the RWAV team for the work that you do across rural and regional Victoria. We hope you've enjoyed celebrating this special 20th anniversary of the Victorian Rural Health Awards. This concludes our virtual event. Thank you for being part of it, and good night.